Welcome to this session on recognising training pathways and supervision requirements for 5 key roles in primary care. In today's session, we will recap the 3 different types of supervision as defined by NHS England. This will be a brief reminder, and so if you have not already done so, we recommend reviewing the chapter on understanding the 3 different types of supervision before you begin this chapter. We will cover 5 chosen roles in primary care and focus on their training pathways, supervision requirements, and how they differ for each role. We will also signpost you to resources for you to find out more. The roles we've chosen are clinical pharmacist, paramedics, physician associates, physiotherapists, and practice nurses. Before moving into the 5 different roles, this slide is a quick recap of the 3 different types of supervision. Let's revise what good supervision looks like under each of these headings. For educational supervision in green, you will understand that the supervisee's skill set on arrival, identify learning needs, assess competency, provide training, and flag any problems. As a clinical practice supervisor or a day-to-day supervisor in orange, good supervision looks like being accessible in real time, minimising barriers for providing support, offering appropriate time to do supervision, and promoting a culture of asking for help. As a professional supervisor in the red column, your role is to know a supervisee and their strengths, weaknesses, and interests. Know their competencies required for their role and provide protected time for learning, promoting trust and well-being. We explore the training pathways in more detail. I invite you to consider a time when you have supervised someone from a role different to your own. I will read through the guided exercise. Please pause at any time to complete the activity at your own pace. Start in the first column by listing the different roles at your practice, underlining those who you have supervised before. Next, list factors that make supervising that individual straightforward, and another list of challenging factors. It is possible that you've not had the opportunity to supervise someone from outside of your role yet. In this case, imagine what the possible straightforward or challenging factors might be. Lastly, think about what other information would be helpful in the supervision contact to reduce any challenges. Interprofessional supervision has been a topic discussed throughout the series on supervision. Here are some of the factors that have commonly come up in those discussions. When we think of potential challenges, it is recognised that supervisors may lack knowledge about other professional training pathways. It can be challenging when supervisors do not know what to expect in terms of a supervisee's capability and competency at each stage of training and even post-registration. Some supervisors have fed back that they feel uncertain about trusting the supervisor's knowledge or clinical skills and have felt uncertain with managing that risk. On the bottom of the slide, we have outlined some resources where you could find out more information to help overcome some of these challenges. Each of the 5 NCL boroughs has a multi-professional educator group, known as an MPEG, with a named contact who leads on the delivery of workshops for supervisors. Further details, including contact information about these MPEGs, is at the end of the chapter. Arranging a meeting between supervisor and supervisee early in placement can help identify learning needs, which should include competencies and capabilities. There are also frameworks for each profession, which include more detail on what to expect of the supervisee at different stages of training and post-registration. For the rest of this chapter, we will summarise for each role the training pathways, supervision requirements, and where to find further information. In this section, we will explore training pathways and supervision requirements for physiotherapists and where to find further information. Become a musculoskeletal first contact practitioner, the individual must have completed a degree in physiotherapy. And once qualified as a physiotherapist, they will spend 2 years approximately as a rotational physiotherapist, where they will gain the breadth and depth of experience they need before specialising. They then must complete a minimum of 3 years specialising in musculoskeletal physiotherapy before they can apply for an accredited first contact practitioner training and education course. NHS England's Workforce and Training Education Directorate has funded 8 education providers in England to provide this training. These courses vary in length, mode of delivery, and certification awarded upon unification, but all courses have been mapped against stages 1 and 2 of the Musculoskeletal Roadmap to Practice document. This is the document that lays out the scope of practice and key skills and attributes individuals must have to become a musculoskeletal first contact practitioner. Individuals, as part of the application process, will need to complete 8 e-learning modules and then submit a learning needs analysis, which provides the applicant the opportunity to evidence any of the skills and attributes required. The university will then use this information to determine which type of course, either the supported portfolio route that the applicant will need to complete. For example, if the applicant already has extensive experience and can evidence this on their learning needs analysis, they may be able to complete the supported portfolio route. However, if the applicant does not have enough evidence, they will be advised to complete the more structured taught route. The university's certificate of completion is all that is required as evidence that the individual is now a musculoskeletal first contact practitioner. This must be provided to any employer. There is not a separate first contact practitioner directory or application process. Should the individual then choose to progress further, they can go on to an advanced level of practice by completing the ACP Masters Programme. Let's have a look at the supervision of a first contact practitioner in general practice. During the first contact practitioner course, the Higher Education Institutes, or HEIs, will provide an educational supervisor to guide the learner through their training. The HEIs will also provide guidance regarding the clinical supervision required in primary care. The clinical supervisor in primary care will undertake the responsibility for signing off the workplace assessments and provide a minimum number of supervised hours. The supervision can involve a mixture of learning, such as tutorials, observed clinics, or peer learning, and this would usually be a minimum of approximately 75 hours, but further guidance will be provided by the Higher Education Institute. It is also advisable for the trainee musculoskeletal practitioner to have protected time to debrief at the end of their clinical sessions and dedicated time for them to complete their work-based assessments. The responsibility of the final sign-off and provision of the certification of completion lies with the higher educational institutes and not the clinical supervisor. Once the individual is a first contact practitioner and working independently, allocated time for support and mentoring is still advisable, but if, of course, in agreement between the FCP and their employer. An example of this could be 30 to 60 minutes every week for a new first contact practitioner, or a minimum of a month for those who are more experienced. Supporting and mentoring first contact practitioners beyond their course is important in terms of quality assurance that the clinicians are working within their scope of practice, they are feeling satisfied in their roles, and it will have an impact on retention as well as aiding their well-being. MSK first contact practitioners are diagnostic clinicians working at the top of their clinical scope of practice. They will have quite a high-level, complex decision-making skills so that they can diagnose, investigate, manage undifferentiated, undiagnosed MSK presentations. They will therefore have to have patient-centered communication and consultation skills. They should be able to take a history, perform examinations, form diagnoses, and able to be identifying red flags and potentially serious underlying pathology, and take appropriate action. They are able to request relevant investigations as well as being able to explain these results to patients. They are also expected to manage discussions about MSK conditions, including prevention, lifestyle interventions, and self-management, including behavioural change, taking an active, personalised care approach within each of their consultations with patients. MSK practitioners will also have skills in making referrals onwards to orthopaedics, and some have completed independent prescribing courses. Vitally, they should be able to discuss with the duty doctor about any concerns they have with the patient, including red flags, complexity of cases, and being able to understand when they are being stretched to work outside of their scope of practice and ask appropriately for help. On this slide, we can see and understand who can supervise who in primary care. A GP can supervise any of these roles, but must have undertaken the GP supervisor course and completed training hub approval. Only GPs can supervise a physician's associate. Otherwise, anyone from any professional role, as long as they have undertaken the London Multi-Professional Supervisor course, can supervise, for example, a clinical pharmacist, paramedic, physiotherapist, or practice nurses. Please note the subtle difference with MSK first contact practitioners, where their educational supervision is provided by the higher education institutes. For further information about supervision requirements, please access the resources at the end of the chapter. Any of the 5 roles discussed may progress to become advanced practice practitioners and can come into contact with patients from an undifferentiated list. Early this year, a revised version of the Workplace Supervision for Advanced Practice was published. In broad terms, the document emphasises that supervision is an ongoing process and has no finite end date. There is an emphasis on it being multi-professional and flexible, where the supervisors must be capable to supervise the relevant domain. It makes the employers more accountable for the provision of supervision of quality and ensuring time is made for it in the supervisee's day. There are clear recommendations for the employers too, such as a requirement that ensures 1. Appropriate supervision arrangements are in place. 2. Supervisors have access to learning and development opportunities, enabling them to provide effective supervision. 3. Advanced practice workforce and business planning includes identifiable provision of supervision. 4. Advanced practice workforce and business planning includes identifiable investment in supervisor development. There are also 2 new terms to help describe supervisors. One is the title of Coordinating Education Supervisor, who is a primary supervisor. The other is an Associate Workplace Supervisor, who is a more supportive role. There may only be one Coordinating Education Supervisor, but there may be many associate workplace supervisors. I will explain this more in the next slide. The Coordinating Education Supervisor provides overarching supervision and coordination of the learning of the supervisee and is able to oversee the progression of the supervisee. In contrast, the Associate Workplace Supervisor provides more targeted support with a focus on specific areas or topics or skills. Together, they ensure safe, effective development to advance practice. To summarize what we have learned in this chapter, we have talked about and listed potential challenges when supervising someone from a different role. You have an awareness of training pathways of the 5 different roles, an awareness of supervision requirements for each of those roles, and you should know now where to find supervision guidance for any of those roles who are taking on advanced practice. At the end of the chapter, you will find further resources and support. Before you finish the chapter, take a moment to think. What do you want to revisit or explore in more detail? What will you do differently because of this learning? Consider making an action plan in your appraisal or discussing it at your next workplace review.